Morning. Hi, I'm Joy. I'm back again. I'm doing these videos as support for my centering class who cannot gather because of the COVID-19 social quarantining. So I did 2 videos discussing a tour of the rooms and also how to get into the hospital. So now I'd like to do a discussion on how to use the equipment in the room during labor and sort of demonstrate some different positions and things so that people can use them during labor for comfort and how to get through this. So we talked about how when you come in, we monitor for a little bit and then get an IV site started, draw some blood work, take your blood pressure, do an assessment. Once we determine that you're in labor, then we go through an admission process that's like 1,000,010 questions. But you don't have to be in the bed for that. So I want to demonstrate how we use the bed in general. This could be a prop. So in early labor, I usually have women walking, moving, rocking their hips, taking showers in the shower, going into the whirlpool that we had shown earlier. All of those things help with that early labor crampiness, contractions. This is a birthing ball. There's 2 different setups here. This is a nice little chair which helps eliminate, it gives you a little back rest, and it helps eliminate some of the rolling and falling away from you. You want to stand in front of it. So actually I did it wrong. So you want to walk, stand in front of it, and then sit back on it because you don't want it to roll away from you. And then you sit with your hips open, and you can hang out like this. So it's a great position. It opens the hips, allows the baby to come down, and it also helps stretch and relax some of those muscles. So a lot of people like this. And so it's not so much this motion. This is not really what I'm looking for. One, you will probably hurt yourself doing this. It will be very uncomfortable. But what we're looking for is a nice stretch in the pelvis. And so you want to rock. Sometimes people do like a circle kind of thing. And so movement during a contraction really helps us cope, whether it's just rocking or just doing, and sometimes when the contraction gets really intense, women will stop and breathe. And the goal is to keep your shoulders relaxed and the airflow. When the contraction ends, then they usually start back up again. Okay? So this is one of the tools we can use so that even if you're on the monitor and you're hooked up, you don't have to be in the bed. The other style is just a regular old ball, and again, I would have you stand in front of it, bring it to you, and then sit and hold on to this. And again, people love to do this, but you can just do like, helps release those back muscles. Forward, stretching the back. And while you're doing this, your partner can be rubbing and massaging your hips and your back like this. So your partner can be helping. The bed, so everybody likes to lay in the bed like this. Oh, oh. Okay, this is a very painful way to labor. The other bad part about laboring like this is the heavy back of the baby rolls towards the bottom of the bed, to the bed, so that it slides down your back and is a very painful occiput posterior position. So, to keep the baby from doing that, being upright is one, or being on your side is another. So it's okay to rest during labor. It's okay to lie down. But doing something like this will help keep that baby from rolling with its back into your spine and keep its back more along your belly so that it can come down better. There's a peanut ball So even if you have an epidural, so if you have an epidural and you can't get out of bed, and we'll talk about epidurals in another video, we can do this kind of positioning. Do you want to get that wedge? Sorry. Didn't hear your squeak. My other videos aren't nearly so professional. I got help today. And you can put your wedge behind your back, your peanut ball between your knees, and this opens your hips. And even with an epidural, you can encourage your baby to not be in an OP position. And the nurses do this. And every half an hour, they'll roll you, they'll flip you, they'll change your position. One of the best ways is to kind of, again, remember, get this leg up and over so that it's not, this is not, I mean, this is okay too, but again, your back becomes more and more and more towards the bed. So you want to do this kind of position, okay? Trying to think what else. Bed, oh yes, right. So, the bed itself can become a prop. So it is flat in this position. It can come all the way up high. What? Oh yes, okay. It can come way up high. And so I have had a number of women do this. So say your baby is a little bit OP, you're having back labor, its back is sliding down your back. Getting your back level, hips apart, relax into it, drop a knee, and point it to the other side. And when you do that, this hip is pressing upward. And I'm not flexible, so breathe, come back to center, drop a knee, and point it to the other side, and press this hip up. And breathe, and come back to center. That position will help release your back muscles, help a baby get in a good position. It also is a great way to just labor and cope with pain. If you've had 5 babies and your belly is very pendulous, doing a lot of this actually can bring the baby out of the pelvis, and so sometimes they will have a woman put a binder on to kind of keep that baby tucked in as they do those motions, and sometimes laboring with a binder, and I don't have one, just to help tuck that baby into your spine, helps bring that baby down in a better position. Something to think about. I've had women bring this bed way up. Oh yes, that's not very high. I've had a woman kind of do this number during contractions. Okay, again, squatting down, using this as a support. Another thing we can do is using the birthing balls or the peanut ball in the bed. And so again, you might get tired during all of this. Your legs are getting tired, right? So you don't necessarily want to be standing the whole time. So some women will take the ball, climb into the bed, and lever like this. This is a lovely way to labor. This is also a really great way to deliver. So at this hospital, the midwives will often deliver babies in this position. Okay? Baby comes out, passes between. Hi, baby. Scoop the baby up, roll over onto your back, and then we can do all that lovely drying, checking everything out, the rest of that. And we'll go into that later. These beds come apart. So most of us don't deliver with the bottom off. Most of us sit on the end of the bed and deliver a baby. And with epidurals and just in general with fatigue of labor, many women choose to deliver lying either on their side, sitting upright a little bit. This bed sits up like a chair to deliver. And this bottom piece can come down just to give room there. But most of us sit to deliver and bring the baby right up onto your chest this way. For other measures, so this looks scary, but say you wanted to, I've had a woman do this before, and this was fun. So, bringing the bed way up. These beds do not fall over. They don't tip. None of that. So in this setting, try not to break the equipment. So we bring the bed way up. And again, women can do this number, sort of to help them with squatting. When I talk about squatting, what I want is your feet flat on the floor and you drop your butt to the ground so that your legs are not holding you up. This is not squatting. Well, I mean it is, but you will do better if you drop your butt to the floor, feet flat. During labor, sometimes pushing this way is good. I have noticed that delivering like this, there's less control of the baby, and so there's more tearing as a result because you just are, like the baby just comes out and I can't control the crowning and the pressure of the baby. But to push and get that baby down, sometimes this is a really great way. I'm not flexible, my knees don't go out. So to prepare for birth in your pregnancy, it's good to do some of this and just hang out like this. And also you can try to keep your back straight and press your knees open so that you get a nice stretch in there. This is a really great pregnancy kind of stretch, strengthening exercise to help stretch, open, prepare. So yes, so when you're squatting, I want feet flat, drop your butt, but you can use your arms to support. And as you can see, you get tired quickly. Put this back together. So I'll demonstrate a little bit of some of the pushing techniques too. So say you have an epidural and you can't get out of bed to do that squat. You can still sometimes, with support from the nurses and your partner, do kind of a squat. So this becomes very chair-like. Usually you're in the bed, so you don't have to climb in like this. So even with an epidural, or say you're getting your IV and you just don't want to lay back, you can sit. Keep your hips open. Put your feet on this. if you have an epidural and pushing is just really hard to feel and you're just not getting a good bit there, sometimes we will have you with support again. Feet flat. Arms over, drop your bum. You can push like this, okay? And when you're done pushing, contraction's over, so your legs get a break and you can, in your arms, lay back, okay? Should I go into like, I'll do the pushing piece? That's fine, okay. When you push, so when you don't have an epidural, like I said, you can push on hands and knees, you can push, you can squat and push, whatever. But generally, we don't require you to hold your breath or be silent. But sometimes it helps to give you power. If you blow your contraction away, you don't always have as much force. And so if you're moving your baby well by going that's fine. But if we sit here and we push and nothing's happening, we're going to suggest take a breath in, hold that air, pull your knees back, and push for 10 seconds without releasing your air. Take a breath, push for 10 seconds more, take a breath, push for 10 seconds more, and relax. So that you get some power behind your pushing. Again, I don't care if you go, and that baby's coming out. That's great, go for it. Some women push like this, and the baby comes out. That's great. If the baby's not moving, we have ways of coaching and helping things. So. Deliver your baby. I have a visitor. So. I'm trying to think what else I was going to say about pushing. With an epidural, it becomes important to do that. Take a breath in, hold the air in, push for 10 seconds. Take a breath, push for 10 seconds. Take a breath, push for 10 seconds. And usually people can support your legs, or you can have your legs up on something to help with that. See what else. Let me see what else to say. Is there a pause? No, a pause. Let's make that good for now, and I will come back regarding labor interventions, things when things aren't normal, or just ways that we can help get a baby out.